Hello, my name is Ordonez, and today I have my family with me in the audience. Imagine your infant is vomiting forcefully after every meal, losing weight rapidly, and doctors can't explain why. Well, that was me at just 1 month old. I was born with a condition that nearly cost me my life, and today I carry a scar that tells that story. Not a lot of people know what pyloric stenosis is, but for every infant born with the condition, every minute without diagnosis is a huge risk. That's why I'm here, not just to inform you about pyloric stenosis, but to urge you to speak up and act fast if you see any of these signs. Pyloric stenosis is a life-threatening condition, but through early action, lives can be saved. So, first, I will go over what pyloric stenosis is and how it affects infants. Then, I will teach you about the symptoms and treatment for pyloric stenosis. And finally, I will teach you how you can make a difference through awareness, action, and advocacy. Now, what is pyloric stenosis? Let's take a quick second to understand the condition. Pyloric stenosis affects the pylori, which is a muscle between the stomach and the small intestine. With pyloric stenosis, that muscle thickens abnormally, blocking any food from passing through. This usually appears in 2 to 8 week old infants. And according to radiopedia.org, it is most common in firstborns and in males, typically Caucasian males. Now, when it comes to me, I am 3 generations deep into pyloric stenosis. I'm a firstborn, and so was my dad, who had the condition. And we also have an aunt in the family that was born with the condition. So when it came down to me, my family was somewhat aware of pyloric stenosis and what to look out for, so they acted fast. Now, according to PubMed, there is an 87% chance of pyloric stenosis being passed down from parent to offspring. So it's important to know your family history. Now, when it comes to the symptoms of pyloric stenosis, according to Mayo Clinic, these symptoms include projectile vomiting, constant hunger, dehydrations such as dry diapers, sunken eyes, and low energy, contractions in the stomach after feeding, and a lump in the stomach as well as weight loss. Now, when it comes to diagnosing it, according to HPS, diagnosis is super simple. First, a physical exam, ultrasound imaging, and blood work is needed, and hospital observation. But it is important to act quickly when it comes to the condition. Now, when it comes to treatment, it is a quick and effective surgery called pyloromyotomy. With this surgery, they make an incision in the stomach and go into the pylori and cut away at the extra tissue, clearing that blockage. It is a full recovery is expected, but it doesn't require a hospital stay after the surgery is completed. But the sooner the better. Now that you know what pyloric stenosis is and some of the symptoms to look out for, it's important to speak up and be that voice. If you're a parent, trust your instincts and push for answers. Now, if you are a healthcare provider, it's important to take these symptoms and signs seriously. Don't brush it off. Now, for everyone else, it is important to spread awareness. Awareness can save lives. Now, while pyloric stenosis is typically genetic, there are ways to reduce the risk. One of these is by breastfeeding as much as possible when possible. Bottle feeding has been proven to increase the likelihood of pyloric stenosis. And according to gov.uk, avoiding early antibiotics such as erythromycin, it has also been proven to help reduce the risk of pyloric stenosis. Now, like I mentioned before, it's also important to know your family history and watch for your newborn closely. Now, remember that infant I told you to imagine. That was me, and I was lucky, but many are not. So that's why it's important to push for answers. Take every symptom very seriously because when it comes to pyloric stenosis, early action can save lives.